Welcome, The Role and Responsibility of Registered Nurses by Vivian Sonorai. Throughout, we will be covering the recent changes and their impact on the roles and responsibilities of registered nurses, the role of the Nurse and Midwife Council in relation to nursing practice, an analysis of the implication of the Code of Nursing Practice, an explanation to the need in effective community in multidisciplinary healthcare settings, and an evaluation to multidisciplinary approach setting. The recent changes in and their impact in the role and responsibility of registered nurses. This covers political, economy, social, technology, organizational, professionalism, and policy. Over the years, nursing has changed significantly. Historically, nurses were considered doctors' assistants, had little authority, and received little formal education. Nurses now have more influence over their practice thanks to their growing skill set. Now nurses can be thought of as licensed professionals who practice independently within their area of expertise, and they're registered with the Nursing and Midwife Council. They can work in multidisciplinary settings and are accountable in delivering safe, high-quality treatment in practicing patients. The 1946 passage of the NHS Act, which became operative on July 5th, 1948. This act brought all medical services under one organization and established a comprehensive health service to improve physical and mental health and prevent illness. Nursing careers are shifting from hospital to universities. The NHS and Community Care Act 1990 was the first major reform of the NHS since it began in 1948. The NHS White Paper Working for Patients 1989 advocated some of the most fundamental improvement in the NHS, which was included in the Act. Care Information Scotland 2022, NHS and Community Care Act 1990. In 1997, the Labour Party modernized the NHS in response to social, global, and economic development. This included primary care groups, health improvement programs, and NIC. All nurses and midwives received an academic education on the Basic Project 2000, which the UKCC introduced in 1989. Student nurses received both their registered nurse certificate and a certificate for higher education. The nurse has undergone changes as a result of the development of computerized care plans that are more effective and efficient in enhancing patient care. Nurses had an adjust to this equipment to speed up research and screening processes, which helped to save more lives. Due to influential supplying issues, the rising public demand, the NHS has experienced significant budget cuts from the government, which had an impact on the resources used by frontline staff. Budget cuts for healthcare have been made since 2008. Financial crisis to help keep government spending in check. The recent pandemic has had a significant impact on the NHS, resulting to a declining in both demand and supply for other resources. The Royal and Midwife Council, which was established in 2001, in the line with the Nursing and Midwife Authority put into place by Parliament and began operating in 2002 in place of the UKCC. In the regulatory organisation for nurses and midwifery in the UK, the primary responsibility of the NMC is to oversee and promote higher education and professional standards of nurses, midwifery and nursing associates throughout the UK. In addition, they are accountable for keeping a record of those qualified to practice, as well for looking into complaints concerning unqualified nurses, midwives and nursing associates, and for responding to those complaints. A newly licensed nurse must nevertheless meet the NMC standards, apply for registration, and pass the competent test. After receiving confirmation of eligibility, candidates must register and pay to take the test through Pearson VUE. Since April 2016, registered nurses have been obliged to view and revise every 3 years to show they are fit to practice, ensure they are providing care in a safe, effective, and professional manner. The nurse must have completed at least 450 hours of practice over the past 3 years and 35 hours of patient continuing professional development CPD over the same time period in order to qualify for revaluation. Likewise, the nurse must have gathered 5 pieces of practice-related feedback over the past 3 years, which may have been from clients, pupils, managers, or teachers. The nurse is required to have 5 written reflections from the prior 3 years, as well as reflective dialogue with another NMC member about their 5 written reflections on their CPD and practice related comments. The NMC Health and Character Declaration of Professional Liability Agreement and confirmation of your revaluation are also required for nurses. This confirms that the nurse is in good physical condition to practice and has not been accused, found guilty, or given formal warning for any criminal offense. The confirmer can confirm when he or she is satisfied with the evidence offered and confirm that you have satisfied the NMC's verification requirements and as stated on the NMC's required confirmation template. The code. The code has 3 themes: prioritize people, practice effectively, preserve safety, promote professionalism and trust. Each theme stands alone and offers a unique perspective on the significance of nursing confidential, non-complications with the code may lead to disciplinary actions. The code. The code has 4 themes: prioritize people, practice effectively, preserve safety, promote professionalism and trust. Every theme is self-contained and presents a distinctive viewpoint on the importance of nursing issues. Regulation, punishment by a regular body, or poor character and incompetent that call for validation every 3 years, and remedial measures like practice hours and continuous professional development can result from breaking the code. Reflective accounts are linked and feedbacked on character statement, health, and reflective practice. In recent years, nurses who had been off the register for up to 5 years were asked to re-register on a temporary registration prior to the onset and pandemic 2019 in 2021. 11,000 nurses and midwives registered for the outbreak. This registration was accessible to nurses with foreign training. It's critical that nurses comprehend 4 P's of the code. When nurses make decisions, patients' safety is their first priority for individuals and groups. A thorough knowledge is important. Although everyone has been affected by the pandemic, nurses still need to be aware of their own skill sets and boundaries and make sure they don't cross them in order to wrap nests have been in the forefront recently, taking on the biggest challenges due to the increased danger that comes with working under more pressure. It will be crucial going ahead to acknowledge that core nurses do not have to ensure the safety of others. The public's perception of nurses who uphold the reputation for professionalism and trust has significantly improved in recent times, thanks to the high level of confusion caused by the shortage. Along with misconduct, their profession may also be the source of criminal convictions to a lack of confidence or violation of a very code they have accepted. The code is used as evidence to affirm the obligation and grief in accordance with the approach which is evidence to them and in keeping with the treatment's objectives, and also encourage what lessons our individuals may learn from the experience. If that is possible, there is no negotiation the code. In order to practice effectively, nurses must possess extraordinary verbal and non-verbal communication abilities. In this case, best practices are being followed in the treatment, most understanding it to the best of their capacities. Naturally, nurses have significant influence on the experience of patients working as a team with different backgrounds and level of experiences is essential in order to maintain safety. Information sharing is a practice that takes time and depends in part of the working setting. A daily commitment is made to uphold the vegetation leases. Nurses make deep judgment with patients' safety at their core. Despite the demands and pandemic has placed on everyone, nurses need to be aware of their own skill sets and boundaries to ensure that they don't cross them. In the recent past, nurses have been on the front line where they have forced their greatest challenges, a level of risk that increased by increased pressure. It is important that nurses come to the realization that they do not have to ensure the safety of others. Encouraging professionalism and trust according to the CQC. There has been significant increase in patients' trust and confidence in nurses despite the shortage. The public also views nurses as a profession that requires certain attitude and behavior, which was reflected in the NMC code. The need for effective communication in the multidisciplinary healthcare setting. Nurses stay in constant communication with all other professionals in their settings as well with patients in order to provide more secure treatment for patients. It's critical to recognize the interconnected role and duty, patient evaluation, quality documents and assistance for more effective work. This optimize the kind of patient treatment and lessens the reputation of information. Communication is essential. Healthcare settings must be designed to safeguard patients, reduce cost, increase case day operational effectiveness, decreasing complaints, increase nurses' confidence, and foster teamwork. A patient may engage with about 50 experts, including consultant, technologists, nurses, and other staff members in a multidisciplinary settings such as hospitals. In a collaborative team environment, accurate sharing of information is crucial. Patients' safety could be jeopardized if vital information is unavailable. Factual error, impressure phone direction, and lack awareness of legitimodification. The NHS spending £1 billion a year because of poor communication. Communication can determine fundamentally if the patient's needs are not fully understood. Certain aspects may be interpreted by patients as systems rather than unquiet persons. Evaluate the effectiveness of the MD approach in healthcare settings. Professionals from several disciplinaries collaborate to provide patients care in multidisciplinary team. The mental health service and primary and secondary community social care are covered under this. In medical settings, doctors, nurses, radiologists, surgeons, and consultants, and many others may work. There is no set structure for the team. Instead, it is flexible and will change from patient to patient. Patient-centered care is the foundation of a various disciplinary approach, and it may be applied in a variety of healthcare contexts, including hospitals and the care sector. In addition to sharing goals and objectives, patient-centered care is shared purpose. Depending on the context, this can vary. For instance, for example, the district nursing team and hospital utilize the same system, but GP patients use several systems for various initiatives. All medical records being on the integrated system would be beneficial in order to guarantee information correctly and expedite professionals. Because of its cohesive nature, communication can become fluid and break down barriers like gender, culture, perception, language, and emotional language. In providing patient outcomes, lowering hospital stay duration, and raising patient satisfaction. Additionally, staff members can enjoy better job performances, less complications, and higher retention rate of experienced staff members. This is very appealing work system that can retain patients and involve them in case discussions while fostering patient accountability. In the end, the facilities family participate in reaching objectives and enhancing care coordination. Obvious that multidisciplinary team should understand patients' preferences to ensure the best timing outcome. There are always time constraints when providing service, and this is sometimes reflected with the disadvantage of lacking the communication within the multidisciplinary team members. If patients are not present during these discussions may be inappropriate or rejected. In conclusion, due to various systems used in healthcare and the drawbacks of multidisciplinary team approach, which would impede the best outcome for various team members and their unique backgrounds. These gaps and lack of information sharing create limitation for the team and the patient. Team must meet frequently and for a long time, which would be a significant barrier at the moment. Backlog of treatments for many patients has been ongoing for years and years. The patient confidence has changed as a result. Each multidisciplinary team should ideally become composed of all experienced professionals, but there will probably be a mix of people at different phases of their career, some at the beginning and some at the end. But given the current demands on the NHS, it is unlikely that the team would function effectively in an ideal world. Everyone would be present and understanding their roles. Healthcare professionals are extremely busy and may be working with dozens of patients every day. Which patient has you inquire documentation which needs to be completed and accurate in order for the team to make the best decision. Inaccurate decisions, missing services, and perhaps catastrophic effects can help if someone lacks the necessary information. The multidisciplinary team approach is successful and effective in theory, and when everyone is working towards the same goal for the patient, good outcomes should occur. However, due to a number of consistencies, including a lack of information and time resources in the constantly stressed NHS system, there is a risk that poor and incomplete decisions will be made, which is not what the patient and their family deserve. Thank you for listening.